Our fourth student is Evan Shannon from Department of Epidemiology. Evan's an MPH student graduating this year. Great. And the title of his presentation is Data Points to Peers, Integrating Information Technology with Epidemiology. Welcome, Evan.
I would like to first thank our Dean, Molina Healthcare, Deborah Breslow, and the trustees of the Breslow Student Fellowship Fund for providing this opportunity for my peers and I to share our visions of the future of public health. To begin, I'd like to go back 20 years ago. These images are probably more familiar to some than to others. But more to the point, this is what technology had to offer in the mid-1990s. At this time, the internet operated at maximum speeds of 57 kilobytes per second, and there was a general mistrust of its capabilities. Fast forward to today. The internet pervades every aspect of our society and has also transformed our discipline of public health. And while epidemiology has done well to adapt over the past 20 years, it could do better to keep pace with the latest technological advances. Fortunately, I believe the field is well positioned to adopt the latest information technology to improve the ease of data collection and dissemination of study results. This can be achieved with the development of sophisticated and integrated electronic medical records, online and smartphone data collection, and social networks within our communities. This is an image of Copenhagen, Denmark. In the epidemiology courses I have been taking in the past year, I noticed that all the large population-based cohort studies come out of Scandinavia, and I asked myself, why is this the case? Well, it's partly because of Denmark's integrated electronic medical records. EMR is in no way a new technology, but it is rapidly evolving in terms of its capabilities. Let's say that Mr. Expialidocious here is one of my patients. Using EMR, I can gather and store immense amounts of data on this patient, including important exposures and relevant covariates such as patient's address, ethnicity, BMI, labs, medication, and even family medical history. EMR has become such a critical tool in healthcare that the Affordable Care Act provides incentives for healthcare delivery systems to implement it. And in fact, UCLA recently received the highest accreditation of achievement for its EMR. Since Fielding is affiliated with a top-tier medical institution with an award-winning EMR, we can work with IT personnel to integrate medical records with our department. This will allow epidemiologists to more easily recruit patient cohorts and gain access to patient data. Further, if, or as I like to think when, universal coverage is achieved, the creation of universal EMR would allow our country to develop population-based registries and design cohort studies with the same degree of sophistication as those coming out of Scandinavia. It's also time to make data collection smarter and easier for study participants. In the near future, epidemiologists will be able to collect data in real time using online questionnaires and smartphone technology, which is a trend that is already beginning to emerge. For example, participants could fill out daily food logs from the comfort of their own homes instead of yearly food frequency questionnaires. Smartphones could also be used to take pertinent images and video. For example, a participant could take a picture of their meal and send it to a study investigator who could then directly assess its nutritional content. Further down the line, it may be possible to engineer exposure assessment devices that can be plugged directly into smartphones. Imagine, for example, a device that can measure air pollution exposure in real time. Since Los Angeles is one of the technology capitals of the world, and UCLA has strong ties to the industry, I believe the Fielding School can be a pioneer in developing this method of data collection. Information technology could be further harnessed to improve the dissemination of epidemiological research to its beneficiaries. Today, the results of research conducted at academic centers are typically reported in academic journals to which the general public has limited access. This is a trend that can be reversed with the use of social networking. I envision a future where investigators develop social networks with community-based organizations such as health centers, churches, and schools. The results of research conducted at UCLA could then be directly reported to the communities who will benefit from this research. We can create vertical networks, from public health schools to community leaders and community members, with information flowing freely between them. For example, if a study finds that there are high rates in asthma in Torrance because possibly of air pollution, investigators could communicate these findings directly to community centers in Torrance, who could then further disseminate these findings to community members via social networking platforms such as Facebook or Twitter. This can be done locally, nationally, and internationally, transforming global public health efforts. To quote epidemiologist Dr. Hans Rosling, as we continue to generate unimaginable amounts of data, more data lead to more correlations, and more correlations lead to more discoveries. I believe that Fielding has the resources to become a worldwide leader in public health through the integration of information technology with epidemiology. This represents a paradigm shift that is critical to ensuring the future success of our field, and one that will allow study participants to become actively engaged in research, feedback, and implementation, thus transforming them from subjects to peers. Thank you.